Welcome everyone. Our today's topic is palatine tonsils, in which we have to describe about the morphology, the relations, the blood supply, and applied anatomy of palatine tonsils. So, to talk about university exams, palatine tonsils are a 5 marker, in which majorly they will be asking about relations 2 mark, blood supply 2 mark, and applied anatomy 1 mark. Morphology they don't ask mostly. And what does relation mean in anatomy? Relation mean what is above that organ, what is below that organ, side of that organ, like that: lateral, medial, anterior, posterior. To say about the blood supply doesn't only mean about the arterial supply, which most of us actually do this mistake by writing the blood supply as arterial supply, and we forget about the venous drainage. So always remember, when it says blood supply, we have to write both about the arterial supply and the venous drainage. Coming to the applied anatomy, the most important aspect of anatomy, the only two things in each question you have to keep in mind: draw diagrams and at last write applied anatomy, even if they have not asked. That adds half marks to your question. So applied anatomy, for any organs, whatever you know, any disease related to it, any surgery related to it, just write that. That is only applied anatomy. So let's begin with this quote. To live your dreams, you have to first dream it and you have to work for it. So now coming to how to write an answer in anatomy, always follow these headings: introduction, define, and when you are writing this, do write the heading also, like introduction, then write introduction, then you have to write. If the question is applicable for a definition, write the definition, write the location of that organ, morphology with a diagram, blood supply both venous and arterial, relations with a diagram, applied anatomy. In some question they will be asking you nerve supply also. Coming to introduction, there are two palatine tonsils. It will be almond-shaped mass of lymphoid tissue. The location is in the triangular fossa, the tonsillar fossa of the lateral wall of the oropharynx. It is between the anterior and posterior pillar of fosses. Now this anterior pillar is formed by palatoglossal arc and the posterior pillar is formed by palatopharyngeal arc. In this diagram covers most of your answer. This is the palatopharyngeal arc, the posterior pillar. This is palatoglossal arc, the anterior pillar. Also, see the almond-shaped palatine tonsils with crypts. There are many crypts. Largest one is called the intratonsillar crypt. It is in the upper side. Now coming to the posterior relations. See, in one diagram only everything is there. So what all are there in the posterior surface? So we have peritonsillar space, we have paratonsillar vein, we have, see, the tonsillar bed. It is very important to mention tonsillar bed in your question about palatine tonsil. Pharyngobasilar fascia, superior constrictor muscle, and buccopharyngeal fascia. The morphology, the medial surface is free, and has crypts, and it's lined by non-keratinized stratified squamous epithelium. Largest crypt, as I said, it is crypta magna, and it represents this largest crypt represent the remnant of the second pharyngeal pouch, which will be you will be reading in embryology. Coming to the lateral surface, it is covered by a well-defined fibrous tissue which forms the tonsillar hemicapsule. The anterior border is present underneath the palatoglossal arc. Posterior border is underneath, which passes underneath the palatopharyngeal arc. Upper pole extend up to the soft palate and is a potential space. There is a potential space called supratonsillar fossa there. Lower pole is attached to the tongue by a band of fibrous tissue called suspensory ligament of tonsil. There is a diagram for this. Coming to the relation, now the boundaries of tonsillar fossa, that fossa which contains the tonsil, we are talking about those that's relation. Anteriorly, there is a palatoglossal arc containing palatoglossal muscle. Palatoglossal arc containing the palatoglossal muscle. Palatoglossal arc containing the palatoglossal muscle. Similarly, posteriorly, palatopharyngeal arc containing palatopharyngeal muscle. The apex is a soft palate in the above side, where the both arc meet, and the base is dorsal surface of the posterior 1/3 of the tongue. You can imagine it when you will look at in the mirror. open your mouth and try to see your tonsils, you will not be able to see, you will be able, not be able to see it clearly, but only a part of your tonsils. If it is inflamed or enlarged, then only you can see the pulse portion. Otherwise, you can imagine. Then the lateral walls or the tonsillar bed. We have this superior constrictor muscle mainly, and this tonsillar bed is formed from within outwards. If we want to say, then pharyngobasilar fascia, superior constrictor muscles, and buccopharyngeal fascia. Say pharyngobasilar fascia, superior constrictor muscle, and buccopharyngeal fascia. As we talk, the fibrous capsule which is attached to the tongue, suspensory ligament of tonsil, from which this tonsil is attached. Then this is the tonsillar bed, this is the tonsillar fossa. Coming to the blood supply, we are going to talk about the arterial supply first. So let's understand this diagram. This is common carotid artery, gives two branches, internal carotid artery and external carotid artery. Now there are several branches of external carotid, but here of our use are lingual artery, facial artery, maxillary artery, ascending pharyngeal artery. From lingual artery, we get dorsalis linguae arteries. See the second point. From the facial artery, we get tonsillar artery, the principal artery for the tonsils. And from facial artery also, there is one branch, ascending palatine artery, which will give branch to the tonsil. Then a branch from external carotid, that is ascending pharyngeal artery, will give its supply to the tonsil. And maxillary artery will give descending palatine artery, which is also known as greater palatine artery, and that will give supply to this tonsil. So this is the arterial supply of the tonsil. Very important, if you can draw this diagram, you need not write all this. If you have time, you may write, but this diagram is enough for it. Just mention external common carotid artery, external carotid, and internal carotid. Coming to the venous drainage, learn two words: paratonsillar vein, pharyngeal venous plexus. The paratonsillar vein descends from the soft palate across the lateral aspect of tonsillar capsule and pierces the superior constrictor to drain into pharyngeal venous plexus. See this diagram, paratonsillar vein, or if you want to see this paratonsillar vein. Nerve supply. Here the question has not asked nerve supply, but it is better to know the nerve supply. So glossopharyngeal nerve and the lesser palatine branches of the sphenopalatine ganglion are the two nerve supply for the palatine tonsils. Coming to the applied anatomy, very easy. Always write applied anatomy in any questions. I'm repeating this because it's very important. First one is acute tonsillitis. Actually, in the school going students, it's very common. The tonsil become a frequent sites of acute infection. Then if the infection spreads into the crypts, then the crypts get started filling with a purulent material, and which presents as yellowish spots, causing acute follicular tonsillitis. Now there is a severe bleeding from tonsillar fossa after tonsillectomy, most commonly due to the damage of paratonsillar veins. And also sometimes after post-operative of this tonsillectomy, the edema of the tonsillar bed can cause can affect the glossopharyngeal nerve, which will lead to the loss of sensation into the posterior one third of the tongue. And the last we'll be talking about the peritonsillar abscess. So there can be the space become a potential space and can lead to accumulation of pus, which will be leading to peritonsillar abscess, which is a painful condition. Thank you.